Hello and welcome to the Encephalitis Podcast. My name is Prav and I'm from Encephalitis International. Today we'll be talking about travel health. To find out more, I am absolutely thrilled to be joined by Katy Peters. Katy is an immunization and travel health specialist nurse. She's a member of the Faculty of Travel Medicine at the Royal College of Physicians and Surgeons in Glasgow, where she qualified with distinction and was awarded the Cameron Lockie Prize for academic excellence. Katy was previously chairwoman of the British Global Travel Health Association. Katy's career has taken her overseas with Médecins Sans Frontières, following qualifying with distinction from the London School of Hygiene and Tropical Medicine. Katy is also director of Riva Limited, an immunization and travel health specialist training company teaching for the Ministry of Defence and the NHS, or the National Health Service. In 2013, Katy founded 360 Health Limited, a London vaccination clinic. I'm delighted to be joined by Katy Peters today. Welcome to the podcast, Katy. How's it going?
Hi, Prav. Thank you very much. That was a lovely introduction, reminding me of my career. Thank you.
Yeah, thanks for being here, and it's a pleasure to have you here. And yeah, let's start from the beginning because we want to talk about travel health. What
Mhm.
is travel health?
So I think travel health is about protecting yourself when you go overseas, go abroad. So you protect yourself and your family for your holidays or for work overseas. And it's also about protecting the community that you're visiting. So I think sometimes that's a really important element of what travel health is. And from a nurse perspective or a medical perspective, we are preparing you for your trip, in the hopes of keeping you safe, keeping you free from illness, um, advising you really on how you can stay safe during your trip and maximize your experience, and also keep the community that you integrate with when you're overseas. You keep them safe as well through the process of vaccination, and also general advice that you can give within travel health. Travel health spans quite a lot of different areas. We talk about vaccinations, and that's the most common sort of understanding of travel health. But there's also malaria prophylaxis. There's a lot of information required or advice needed about keeping your quality gut health, preventing mosquito bites, and general sort of well-being when you travel to different areas and different cultures. So it's quite an expansive subject, and it's a lot of health promotion in it.
Wow. And that's something you've already made me think because I had not thought about the fact that, yeah, it's for the benefit of the community that you're also visiting. I think we normally think about your own travel health, but actually, yes, we need to think about the wider, I suppose, herd immunity goes along with that as well, and things like that as well.
Exactly that. And when we travel to other countries, particularly countries that are sort of less developed than the UK, there are different levels of vaccination coverage. And so sometimes you may be in a community. Let's take an example of Central Africa, maybe Central African Republic. You could be there, and you'll be mixing with young children who have not had access to vaccines. And so simple childhood diseases like measles can, if you're not immune to that, if you're not vaccinated, you could pass that on to these vulnerable children. So it's a huge component of travel health that can be overlooked, but is really important about protecting our community outside of the UK.
Brilliant. And so you mentioned that travel health is more than just vaccines. Could you talk us through the general process of travel health?
Yes. So we tend to prioritize as a traveler, we tend to think about what vaccines we need because you'll be with your family and your friends and you'll say, I'm off to Costa Rica, and someone will say, have you had your vaccines? So the vaccine seems to lead a lot of our inquiries in travel health. But what we do as a travel health provider is you do a risk assessment. So you ascertain, if you were going traveling, Prav, I'd say, well, where are you going? How long for? What are you going to do? And then we'd look at what vaccinations you'd had, and we'd look at what you need for that country, what diseases are endemic in that country, which are often contrary to what's endemic or common in this country. So you'll need additional vaccinations. But on top of that, vaccinations is just a small component of travel health because there's also your current well-being. So say you were a diabetic or you had heart problems, we would need to help you manage those illnesses in a different climate, in a different culture, perhaps where there's not access to medication or hospitalization. So there's that general health promotion on a personal level regarding your current medical history. And then we look at, well, what diseases are out there that have no vaccines to prevent them? So we might look at things like chikungunya or Zika, where currently there's no vaccine available for us. Malaria is another example. And how do we prevent you getting that? We would talk about bite prevention, mosquito repellent, mosquito nets. We would tell you about when the mosquitoes bite. And we'd talk a little bit about the hosts or vectors. So how do you get this disease? Is it because you're hanging out with pigs and wading birds, or are you hanging out in the evening and getting bitten by mosquitoes? And then there's, on top of that, there's things like sexual health, there's safe food and water hygiene, there's legal implications of some cultures. There's depending on who you are, we might have special advice if you're visiting friends and family overseas, or if you're an 18-year-old going on a gap year to Thailand. So there's lots of different elements of travel health that that we need to address and touch upon when we see you in a consultation.
Amazing. And I kind of want to focus now on encephalitis. So what is the
Yes.
relevance of encephalitis to travel health?
So I recently attended a fabulous encephalitis evening, and I was very interested to hear about encephalitis as a general health issue. But from a travel perspective, we have two areas where we focus on encephalitis. There are two diseases that can cause encephalitis, which is swelling of the brain. And those two diseases, which are vaccine preventable, that we're going to focus on, is tick-borne encephalitis and Japanese encephalitis. And these two vaccines are, in essence, travel health vaccines because we don't require them for the UK. Now, if we start with tick-borne encephalitis is passed by a tick, and ticks are in long grass generally and woods, and they come to life, so to speak, during spring and summer. And so you're at risk if you're in areas where these ticks exist, and particularly if you're sort of in the spring and summer doing walking holidays, anything that takes you into the woods, camping and into the grass. And these ticks find you and they suck your blood, and they can cause this disease called tick-borne encephalitis, which is very dangerous. And so we would vaccinate you against that disease to protect you. And tick-borne encephalitis is so common or endemic to a lot of Eastern Europe, parts of Russia. And it's so common that, in fact, some countries like Austria, they include this vaccine on their national schedule. So it's as familiar to us as maybe the tetanus jab that we get over here. Their citizens get this regularly. So what a lot of travelers don't realize is that when they go to areas of Europe, and you could argue, if you go walking in the Alps in the summer, there is this risk of tick-borne encephalitis. And you need 3 vaccines. You can have 2 before you leave and then a booster per se, but you do need a course of vaccines. It's available to children and adults. And it's really a very important vaccine to have because, as you know, working for the charity that you do, encephalitis has a massive impact on people's life and also quality of life. So that's one vaccine that we discuss. And you can have the vaccine, but you can also use special mosquito repellent, wear long boots, things like this. Check yourself after your walk, and there are certain ways to remove the ticks. So it's all there's a lot of health promotion alongside the vaccine. Japanese encephalitis is more of a tropical disease. So we see that for its namesake. So if you remember Japanese encephalitis, think of Japan, but it's predominantly the eastern side of our globe. So it's India, Sri Lanka, Southeast Asia, China, Japan, Indonesia, possibly the Philippines. And you see Japanese encephalitis. Predominantly, we're seeing children getting this disease, but anyone can catch it. And It's a disease that is spread through mosquitoes. So the mosquitoes are the vector, they give you the disease, but the host where this disease sort of grows and matures is in pigs and wading birds. So we find this disease in areas where there's water. So you can picture a sort of paddy field environment, and maybe there's farm, and you've got the pigs and wading birds, and this is perfect for the mosquito, who can then bite the pigs and wading birds, and the life cycle starts, and then they bite you. And it's a dusk till dawn biting mosquito, so you get it overnight, and it's very serious. So we in travel health, we think of it as the rule of three. So the statistics or the epidemiology tells us that a third of people who contract Japanese encephalitis will have no symptoms at all. You won't know. A third will have long-term serious neurological deficits, which you will know from working with the charity can be, absolutely, very, very serious and sort of devastating for you and your life. And a third of people will actually die from the encephalitis, and there's no treatment. So it is really a very important vaccine, and it's a very important disease to be aware of. It is really very rare, especially in travelers. But the rareness sort of gives over to the impact. The impact is huge, and you will know we have cases where young people will go traveling in Southeast Asia and will contract this disease, and it has long-term consequences on their health. But as I say, it's rare, but it causes this encephalitis, this swelling of the brain. And so that vaccine is available for little ones, children from 2 months, and adults. And there's boosters, but again, there's a lot of health promotion around this. So mosquito bite avoidance, dusk till dawn, and sleeping on a mosquito net. All of these things can help. But these are the two diseases that in travel health we focus on that can cause encephalitis. And luckily there are vaccines available. So when we think of, as a travel health professional, when we think of encephalitis, we immediately think of tick-borne and Japanese encephalitis.
Brilliant. Yeah, and you make a very interesting point, very important point, that just because it's rare does not at all mean that it's not serious. It's such
Yeah.
a contrast, and yeah, very important point to raise there. And so one of the words that we've been talking about a lot is vaccine, and I
Yes.
just wanted to know, what do we mean by a vaccine?
Wow. So a vaccine, what a vaccine does, a vaccine controls the spread of disease. It provides long-term immunity, and immunity is just protection. So I want you to imagine that if I gave you a Japanese encephalitis vaccine, what I'm doing is I'm giving you soldiers to fight the virus or the bacteria, or whatever the component, the pathogen might be for the disease that we're vaccinating you for. So I'm giving you soldiers that are ready to fight if you get exposed. And so a vaccine controls the spread of infection from the perspective that if it's a communicable disease, so if it's something that spreads from person to person, and I give you a vaccine, it stops you spreading that disease to your friends and family, because you're immune, you have the soldiers, and so the soldiers fight the disease before you get signs and symptoms. So before you can cough on someone, for example. Some diseases are spread from person to person, some are not. Some are spread by mosquitoes or through the bite of a dog, or various different ways. So when I give you a vaccine, I am priming your immune system to be able to fight the disease when you're exposed to it. So you may still get exposed to Japanese encephalitis, mosquitoes will bite you, but you've got this army inside that will deal with it straight away so that you don't get ill. So a vaccine mimics the immune system's natural propensity to learn from the viruses or bacteria that we ingest or we take in. The immune system is a wondrous thing, and it can create these long-term soldiers or weapons to fight these diseases. And a vaccine mimics that. It's remarkable. It's a remarkable part of our human development, and they just mimic. And in a lot of cases, we're not injecting the actual disease into you. We're injecting a sort of a mirror, so to speak, of that disease. And so there's it's a wondrous thing, and that is what a vaccine does. It controls the spread of disease, it protects you, and it gives you that long-term protection. So it's pretty amazing.
Brilliant. Yeah, thank you so much for that. And going back to encephalitis, are there any kind of misconceptions you have encountered about encephalitis risks in different parts of the world?
Well, I'll tell you something that I found absolutely fascinating when I went to a recent encephalitis presentation that you guys did, was, and I don't think any, I mean, I didn't know this, and I know that our travelers don't know this, and it does tie into travel health, but it's the herpes virus. The herpes virus, which you can get through sexual health, that can cause encephalitis, and I didn't know this, and I think that's a really big area that people need to understand. And from a travel perspective, for all ages of our travelers who are going to travel and are going to experience, sexual interaction. And the evidence suggests that we do, take more risks when we're outside of the UK. And so across all ages, people may experience more sexual interaction. Contracting herpes through sex can be is a long-term issue. It stays in your body forever. And what I learned at the last event was that this can cause encephalitis. And so there are additional ways you can get encephalitis, and herpes is not obviously the only one. There are lots of diseases that don't primarily relate to tropical diseases, which is what we would normally think about with travel health, but interplay into your life, both in the UK and as you travel. Now, obviously, we also need to think about treatment available to you if you're traveling and you get exposed to encephalitis through many different ways. It's also a problem with rabies, but in many different illnesses that encephalitis can present. What's the treatment available to you? So we have to think about the standards of care where you're going. Your insurance has to be thought of from a perspective of travel health. The understanding of medical professionals in the country of visit, and also one must also think from a global health perspective. What about the local community? So the local community need to use the hospital and the health services, and if you're using those services, you are putting pressure on the local community's access to healthcare. So we always think that as well from a global health perspective. We're a global family, and where we can afford to take precautions in preparation for travel in the UK, where we have access to adequate sexual health education, adequate travel health education, vaccines, support. We must acknowledge that that is our responsibility, so that when we go over to areas where people don't have that access, we are not adding pressure to a potentially high pressure environment. So I hope that answers the question that you asked.
Absolutely, yeah. And one of the things you mentioned was insurance, and I was
Yeah.
wondering what you would say about people who might say that vaccinations, for example, are expensive and this is a
Mhm.
hurdle to getting a vaccine.
Yeah, it's really true. They are expensive. It is a challenge. Um, there are a lot of tropical diseases for some trips, and we're wonderfully making more extensive trips. What we have found as well is the older population are making more extensive trips. People who may previously not been able to travel so much, our disabled family and community, people with additional health needs. We're traveling much more extensively, and it is essential that you have insurance. I know that from my family, for some of my older family members, getting insurance is challenging and very, very expensive. And you've got to consider that with your airfare, with your experience, and with vaccines. So yes, travel health, it is an expensive undertaking. I think what the positive thing about vaccines is that they tend to last a very long time, if not life. So a lot of our vaccines now last for life. If you have a course of rabies, a course of Hep B, if you have one yellow fever, you have lifetime immunity in most cases. There are specifics, but So it's a one-time investment, and you are then pretty much able to travel globally all over the place because a lot of the vaccines you need for every trip. So it is an expensive investment, but it is an investment for your health. And ultimately, our health is the most important thing in our lives. And they say there's this quote that they say that a well man or woman has many, many wishes. A sick man or woman has just one wish. And I think that's a really important quote to consider when we're looking at paying for our own healthcare. It's the most important thing in our lives. Without good health, we can't support our family and friends. We can't give back. So it's a really important thing. So I think thinking from that perspective is helpful. From insurance terms, the problem is if you have not had a travel health consultation or got the vaccines that you may have needed, your insurance company could push back against you. So we've heard of cases where they push back with the rabies. So if you haven't had pre-rabies vaccination and you then get bitten by a dog and you require a lot of treatment, they can push back. So that it is quite an important thing to consider. Insurance, I mean, it's very risky to travel without insurance because of the cost implications. If you're in a road traffic accident, for instance, we see high numbers of RTAs, road traffic accidents, across the world in travelers. And without that kind of level of insurance, it's an extremely expensive process, especially if you go to the States. So insurance is important. It's just one of those things you have to do, really. And if you take the Japanese encephalitis as an example, you might think of that as an insurance because you're basically taking the vaccine to insure against future illness, and it's quite a big investment that you need to take to have Japanese encephalitis and rabies and Hep B, but it is long term, and it is prioritizing your health. So yeah, it's you've got to weigh it up. You've got to weigh it up, the risk against the benefit. It's
Brilliant. Yeah,
challenging.
thank you so much. Yeah, I was going to say thank you so much for that very balanced answer. That was brilliant. I'm going to sh shift gears a bit, and I'm going to ask you about what drew you to specialize in the field of travel health and nursing.
Yeah, yes. So when I was very young, I saw an Oxfam video, and you may recall this. I mean, you're a lot younger than me, but we used to see these Oxfam adverts on TV, and it was predominantly like little kids who were suffering. And I remember seeing this little kid. I see him now, and he was suffering, and he had he had flies, and he was really uncomfortable. And I was like, oh, I could just help. And my feeling was, if I was there, I could pick him up and I could make him feel better. And it was had a huge impact on me. And my dad, my lovely dad, he worked in Africa as a young person, and I grew up on his stories. And so I decided really at that point I wanted to be an aid worker. And I was very fortunate. My dad introduced me to Médecins Sans Frontières, who are a really amazing organization, and that was my dream. And so I became a nurse to work for Médecins Sans Frontières, to be an aid worker, and I directed my entire career towards that outcome. And I did become an aid worker, and I worked in the Congo, and I worked in India, and I also worked in the Caribbean. And when I came home, um, obviously I did tropical medicine as my background, tropical nursing at the London School. And when I came home, a friend asked if I would set up a travel clinic in their London GP surgery. And I was like, well, I've never done that. I don't know what that is. But he said, well, you've got background in tropical medicine. How hard can it be? So I did. I set up a travel clinic, and that was the beginning of my career in travel medicine, which I suppose I've been in now maybe 15 years. And from that, I set up London Travel Clinic and then London Vaccination Clinic, which is my company now. And it's a very, it's a wonderful area to specialize in. It's nurse led in many ways, and we have a lot of pharmacists now in travel medicine. And so it's a wonderful autonomous role, and it's joyful because you're learning about tropical disease and other cultures and countries, and you meet people who've got the most amazing stories, and people are doing exciting stuff around the world, and it just connects us, with our global family. So it means a lot to me. I love this specialty, and I teach it as well. And it's an honor, really. I mean, when we teach practice nurses and pharmacists and vaccination. It's a wonderful thing to protect people in this way. I love it. I recommend it to anyone.
That's brilliant. Thank you for that. That's very inspiring. We are coming towards the end of the podcast, actually, but I did want to ask, to do with your career over the 15 years you've been in travel health. I was going to ask specifically about encephalitis, but
Yeah.
have there been any kind of general trends you've noticed, any changes throughout this career?
Yeah, wow, that's a very good question. So when I started, I think I think access is a huge thing. People are able to travel now everywhere, and people are doing the most amazing trips. And I've seen a huge increase in the numbers of older people, over 65s going on fabulous trips. People are doing much more, we call it volunteer sort of tourism. So people are actively getting involved in the local communities that they visit. So I've seen a shift in what people are doing, and the age ranges of what people are doing. I've also seen uh, an opening of acceptance about what people might be doing. So from a health professional perspective, and also from the traveler, that there's just so much more possibility. And before, the idea of going on a sort of walking trip in Iran, or through through central, going down the whole of Central Africa, would have been really out there, and it's not now. People are really able to access other countries, and are doing really exciting, interesting things. The rise of Airbnb and living with people. When you go traveling, you stay with local people. That's a beautiful thing. I've done that a lot, and it's wonderful. In terms of tropical diseases, encephalitis, vaccinations, there's been a general decrease in the requirements for malaria prophylaxis. So it's predominantly Africa. It's not just Africa, but we've seen a general decrease. We've seen polio being nearly eradicated. It's only in Afghanistan and Pakistan now. We've seen a massive increase in the availability of vaccines. We've got a dengue vaccine. We've seen changes in the schedules. So Japanese encephalitis used to be 2 doses over a month. Now you can have 2 over a week. Rabies schedules and accessibility has changed dramatically. So for our clients, I think for our travelers, there's more access to more vaccinations. There's more access to evidence research and health promotion. Japanese encephalitis, pretty consistent. It's rare, but it's there. Tick-borne encephalitis, there's been an expansion. So we're starting to see these strains of encephalitis from ticks coming into Europe, coming into the UK, I'm sorry. So we know about Lyme's disease, but there's been some cases of this tick-borne encephalitis in the UK. So we're seeing an expansion of the movement of ticks, the movement of mosquitoes with climate change. Climate change is having a huge impact on travel health, because as we get warmer climates, we're seeing the vectors that pass on some of these diseases being more comfortably able to live in different areas, Europe. We've seen dengue in Italy and France. Very, very worrying. So I think there's that as well. And there's a huge thing as well as our global population moves, which is with climate change as well. We're going to see this over the next 10 to 20 years. We're going to see vast changes in borders and how people are moving. And we're going to have so many more of our community, our brothers and sisters from global countries, moving into Europe, that will change things. And we've seen that, for instance, in the UK with an increased incidence of diphtheria and some polio worries, risks. And this is just going to happen normally as we mix with each other more. And so there's lots to think about from a travel health perspective. It's a very interesting and dynamic area, but really I think the most important thing to look at, and indeed from the encephalitis perspective, is constantly look globally. So not centralized, center ourselves around the UK, but look at the global perspective of encephalitis, and how that may impact us, and try to not think of ourselves as an island, but really part of the global community, and how the changes in our world will impact on our health, and indeed on encephalitis as a health concern.
Thank you, Katie. That was very poignant. I think, yes, on the one hand, while we do have better access and an increasingly globalized world and volunteering tourism, which is an incredible thing that didn't exist before, really. On the other side, we do have climate change and these really serious risks that we need to be aware of and for which we need to think globally. So that's very
Yeah.
important. Thank you, Katie. We have come to the end of the podcast, but I was wondering if there's anything we haven't discussed that you'd like to mention.
Well, I mean, I'm aware that we are specifically talking about obviously Japanese encephalitis and tick-borne encephalitis and encephalitis from a travel health perspective. And for me, I'm very interested in it from the grander scheme, but it's not my area. So I'm not gonna make any comments beyond the small amount I learnt when I was with you guys, and that was a wonderful evening. The WHO release that was fascinating. So I will only say that I support your organization. The work you're doing is really wonderful, and I'm so thrilled that we're working with you, and the travel health community can work with the Encephalitis Association, to Encephalitis International, to improve people's lives in this area. So I'm very grateful for you taking the time to learn more about travel health. So thank you very much.
Thank you, Katie. And yes, for our audience, just to give some context, the World Health Organization published a technical brief on encephalitis just last month, actually, in time for World Encephalitis Day on the 22nd of February. So yeah, really throwing into sharp relief the importance of encephalitis in the global stage.
Yes, yes, it was actually very interesting document. So I recommend everyone to take a look, because I found it fascinating, and I learned a lot from it.
Yeah, hopefully a game changer in how we
Yes,
tackle this. Yeah.
yes.
Well, we come to the end of this podcast with Katy Peters. I want to thank Katie for sharing her valuable time with us. Thank you so much, Katie. It's been a pleasure having you.
Pleasure. I've enjoyed it. Thank you.
And I'd like to thank you, the audience, for watching. We hope you have found this episode of the Encephalitis Podcast helpful. If you've been affected by any of the issues raised, please contact our support line. Encephalitis International is here to help in whatever way we can. For more information and our contact details, please visit our website, www.encephalitis.info. And together we can achieve our aim of ending death and disability from encephalitis. You can also find all the information you need in the podcast description. As always, if you can support our work, we would be extremely grateful. Please visit www.encephalitis.info/donate. Thank you again, and see you next time on the Encephalitis Podcast.